Welcome to the Dr. Dad's podcast, where a naturopath and chiropractor come together each week to share lifestyle medicine, health advice, and inspiring interviews with some of the top experts in health and wellness, bringing you the latest in nutrition, exercise, ancient healing, toxins and detox, your microbiome, mindset, hormones, brain, and much more. Stay tuned. We're going to teach you how to experience growth daily.
What's up, everybody? Welcome back to another podcast with the Dr. Dads. My main man, Dr. David Wardy. What's up, buddy?
I'm fantastic, brother. How are you, man?
Well, it sounds like you had a busy day. You're a short week this week, and you were just running around, just getting stuff done.
I feel like that's been like the last week and a half, man, but it's good. Like I'm being very productive, lots of moving parts, but I mean, I think the new year always brings a little bit of that, and then we kind of hit our stride maybe 3 to 4 weeks into the year.
Yeah.
But yeah, man, like just a lot of things going on. We're leaving town, we're taking the office to a conference and our like kickoff retreat for the year to kind of do our own little like jump start for the clinic and get them educated and motivated and all that fun stuff. And so it's a short week, but then I've got the metabolic reset coming up, which we're going to throw here in February. So just a lot of stuff, man. You know how that goes.
Oh man, big time. What's your take on just how people are responding in this year? Do you feel like there's, say, more people coming in than typical in a January, or like what are you sensing?
You know, the first quarter is always a big, busy time for us. You know, everybody always has their resolutions and they're starting the new year and wanting to make changes, and their health is usually at the top of that list, right? So we get a lot of people that are coming in and they're just ready finally to tackle some of the health issues that they've had. And some of these people have been struggling for a while. But yeah, January is always a really busy month, pretty much through April for us. Of a lot of people coming in that are really have just big health issues, and there's a lot going on with them, and it's time for them, which is good, right? Because you and I both know, like we always talk about that saying from Hippocrates, right? Like unless you're like, what is it? Oh, I gotta grab it real quick. I can't even read it off real quick. There we go. Before you heal someone, ask him if he is willing to give up the things that made him sick.
Yeah.
And I feel like people, you know, when they come around in the new year, they're trying to think about, okay, what needs to be done, you know, and when it comes to your health, man, I think people just finally make those bigger decisions sometimes in January. I don't feel like the new year should ever be that mark to do that. I think you should do this whenever it's necessary. Mm-hmm. But for whatever reason, everybody hits that reset button, you know, this time of year, and then they're ready to go. So we got a lot of programs starting up with new patients. And then, like I said, we're going to do a metabolic reset for 7 weeks. So yeah, just trying to get everybody jump started.
Yeah. Yeah. It's interesting. I feel like earlier in our career, January was sort of slow to start, but you know, as the years have gone by and I think that there's just more people waking up to, you know, taking care of their health, and, you know, maybe our reach is just growing as well. And people are just recognizing us more and the potential for healing and some of the cool, innovative tools that we've brought into our clinic, no doubt, are also waking people up to self-care, you know, which is the whole idea behind the Vitality Lab and the Longevity Lab. So on that note, though, we want to dive into hyperbaric oxygen as one of those, you know, staples for prevention and health span and longevity and all that stuff. So tell us your journey of, you know, the Vitality Lab maybe, and then why you felt like hyperbaric was such an important tool to bring in for self-care.
You know, you and me had conversations. You were like a year or two ahead of me with your all's longevity lab. I think it was at least a year.
I mean, we launched ours and then the pandemic hit. So like,
that's right.
It was the worst time to launch a business, of course, but so it was right in 2020 that we had all our equipment. Yeah.
So I started mine last year. So that would be 2022. Yeah. So you were about 2 years ahead of me. So it was funny. I had you told me one day, you're like, buddy, why don't you start a lab? Like you have a bunch of stuff already. You just need that.
You already had the lab. You
already had the lab. I was like, okay. So I thought about it. I was like, yeah, he's right. So yeah, we started ours last 2021, December of 2021 is actually when it started. And I spent a lot of time trying to decide, okay, I have some cool biohacking therapies and tools already, but I wanted to add some anchors to build the lab to where we had some really good, just anchoring type biohacking or therapy tools that people could come in that were very potent medicine that would make big changes with their health. And so I sat on it for a while. And the first thing that I decided was to do the red light LED bed. And that's when we went with the light stem bed. And we did that in December of 2021. And it's been awesome, man. Like the light bed it's amazing. Very different than most light beds, the one that we have in the clinic. So just for the listeners real quick, most of these red light beds you'll see, they're either panels that you'll see that are vertical or where they've mounted them to the walls and you just stand close to them, or it'll look kind of like one of those infrared sauna beds, not infrared, but like a tanning bed.
Yeah.
Where you have the top and the bottom and you climb in and you close the top. But, after doing research for a while, Dr. Hank Williams talked to me a little bit about why he picked that bed. So interestingly enough, red light, to get the therapeutic dose, you have to be very, very, very close to the bulbs on wherever you're getting the light. It's not enough just to be close to the light, because a lot of that power and you're losing a lot of power and the therapeutic dose the further away you are.
Yeah.
So the reason Lightstem built their bed the way they did is because to get a full blown treatment, you have to do 20 minutes on your back and 20 minutes on your stomach. And that's because you're like almost touching the bulbs. And then they have a very specific type of material that they used as the glass like covering, or it's acrylic that sits on the bulbs. And it makes sure that the light is actually passing through the acrylic at the right angle to give you that therapeutic dose. So with a lot of these other companies, man, like the one that you close the thing on top of you, you're too far from the top. So you're not really even getting that therapeutic dose. You're only getting the one that you're laying on. So you're losing a lot of that dose. And so some of these beds that have like 40 to 80,000 bulbs, it's unnecessary. So like our light bed, I think, has close to 19,000 bulbs. It's got the infrared, and then it has 4 different spectrums or 4 different frequencies pushing through the red light. And so that bed is really cool, man. And I love it. You've heard my stories about it. Our patients and practice members love it. The Vitality Lab members love it. It's literally on all of our circuits, and it's been amazing. So after I got that one going, I knew that I eventually was going to add something else. And you and me had talked about HBOT. And so we talked about hyperbaric oxygen therapy. And I'll be honest, I was a little nervous to bring it in initially. But then after talking to you and some other practitioners, I was like, no, I need to do this. So we brought in hyperbaric at the end of this past year. So like right around, I think it was October, I think, or September, we brought in the HBOT. And we kind of went and teamed it up with another therapy. We do red light and HBOT back to back. We call it the superhuman circuit. And buddy, that's my favorite circuit. Like it's becoming a lot of other people's favorite circuit. They love getting on the light bed than jumping in the hyperbaric. But man, hyperbaric's been awesome. I had my first experience with HBOT when I was in grad school. I'll tell you a quick funny story. So we were I was at a seminar for Parker Seminars when I was in grad school, and they have a big expo at their conference in Vegas. And there was an HBOT booth, and me and a buddy of mine had actually been out a little late the night before partying in Vegas. Okay. Give me a break.
That's what you do when you go to Vegas, right?
Yeah, I was in my early 20s, everybody. This is what you do. So I think we went to bed like at 4. I slept 2 hours, got up, went to the conference. And so we were a little hungover, I'm not going to lie. And we're talking to this guy, and he's like, yeah, why don't you guys jump in for 30 minutes? So we jumped in. He went first, and I went. And it was amazing, man. I got out of that thing, and it literally took my hangover away. Gone. Like gone. It was just, I went from feeling like crap to got out of that thing, and it was like I was a new person for the rest of the day. So that's when I was like, okay, there's something powerful about oxygen. So, fast forward to now, bringing it in as a therapy and a tool for our patients and practice members to start to use. And buddy, after looking at the research and what's available now and what they're seeing that this helps with, this is an amazing therapy. A lot of people have these in their homes because it works so well to help with their overall health. But the amount of things that it can do in a short amount of time, I only do 30-minute sessions in there. I haven't even done a full hour yet. And just a 30-minute session, you feel amazing when you get out. So I'm very happy about it. And I wanted to dive in with you today. You've talked a lot about yours, and I think you've done some stuff on your website where you've gotten into this, but I want to go back and forth with you and just kind of get into the nitty gritty of all the benefits of what hyperbaric oxygen therapy does, the science behind it, and then, why somebody would want to do something like this.
Yeah. I mean, our experience was a little different. I got into hyperbaric. Obviously, we talked to Dr. Jason Saunders, and he's been having a ton of success with it. And he's now doing a PhD program to really investigate the different, therapeutic benefits at different pressures and things like that. So Dr. Jason Saunders is an amazing resource in the field of hyperbaric therapy. And obviously, David and I are, honored to be able to call him friend and colleague and everything. So a lot of my
on, right?
Pardon me?
We had him as a guest.
We did, yeah. So for some of his dialogue, people can just go back to that. But the main reason I wanted to get it was, a lot of the therapeutics, even in our lab, I keep thinking about my mom who went through hemorrhagic stroke 9 years ago. And so I know hyperbaric was a very powerful tool for people post, TBI or post-stroke, as a way, even post-concussion and some of the other CTE kind of situations. Chronic traumatic encephalopathy. So I wanted to see what kind of value it would add to her. And then obviously we get a chance to try it on a number of different patients, and then also implement it into our longevity lab as a tool for longevity and just reducing inflammation and just all the things that it could potentially help. And so when I'm speaking about this, just for those listening, this is not, research. It's more like a clinical application of what I've noticed. And the main thing is when we first got our HBOT, we had been running at this 1.3 atmospheres of pressure, which is considered low-level hyperbaric therapy or pressurized air therapy. This is before we added an oxygen concentrator. And a lot of the interesting information research that's done on, say, wound healing to, people with cancer to diabetic, issues to post-stroke and other traumatic brain injury, a lot of the research is done on these higher pressures. But more and more, people like Dr. Jason Saunders and others are starting to look at some of the low-level therapeutic benefit. And so clinically, like what we found is, most people that go in there come out just feeling like their brain is like the brain fog is clear, the energy comes up. We've had some people with long COVID that have done really, really well at helping to recirculate oxygen to all the different tissues that were stuck in an inflammatory process, to, post-traumatic brain injury, to post-viral issues like shingles, and speeding recovery there, post-fracture, expediting recovery. So what we found is that it's just such a valuable tool to implement into any program, because what you're doing is you're increasing oxygen delivery to tissues that are stuck in a state of inflammation. That as we learned with Dr. Tom Levy, any chronic inflammation is an area that's hypoxic, so devoid or decreased significantly in the supply of oxygen, and also vitamin C deficient, which is one of his core postulates for chronic inflammation. So what we found is that it's just a really amazing core adjunctive tool in considerably everything that you could possibly, have go wrong with you, because oxygen, as Jason says, is a nutrient. It's something that we absolutely need to function on this planet. And if we're stuck in inflammation, we're going to be hypoxic to some degree. So I realized in having in our clinic that the utility of it was just so vast, because it's just working on the basic fundamentals of human physiology.
Well, it's massively vast, right? And I'm glad that Jason is getting his PhD to go on this low level therapeutic, because there is a ton of benefit on the lower therapeutic end of hyperbaric. It doesn't have to be these big metal chambers to get the benefit. And you're right, that's all we're seeing in the research. But as you and I understand clinically, like there's awesome stuff that happens when you use oxygen. So for our listeners, brother, why don't we tell them kind of how that works, like how oxygen is uptaken into the body, and how we pretty much don't have any extra in real time, and then what happens when we go under pressure and all that stuff. Let's take them on a journey of how that works, and then we'll talk about some of the benefits when you do these things more regularly.
Yeah. So, the way that I'm sort of repeating a little bit of Jason's stuff, but the way that I understand it is that we're walking around at varying degrees of pressure as a result of the location that we live on in the planet. So here in Vancouver, we're at sea level. I don't know what the altitude is at El Paso. I know you guys have some higher elevation probably than we do, but depending on where you live, there's going to be varying degrees of elevation. Obviously, Utah, Colorado, some of these places, obviously very high elevation. But no matter where you go on this planet, probably in nature, you're going to get maybe slightly higher concentrations of oxygen. But let's say in a city, you might be getting anywhere from like a really polluted city, you might be getting 16, 17, 18% oxygen, upwards of 21% oxygen. And there's other gases obviously in the air, nitrogen, different things that are circulating in the air. But relatively speaking, you're going to be somewhere between 19 to 21% oxygen. And whether you're in Utah or the top of, a mountain, the difference is the amount of pressure. So obviously at higher elevation, lower pressure, which is why people feel more fatigued when they climb up a mountain. But when you go to sea level or below that, so apparently the lowest below sea level area on the planet is the Dead Sea area. And so that's technically a high pressure situation. So the lower you go, the higher the pressure, just like when you're, doing scuba diving, the lower you go, the higher the pressure. So when you go to the Dead Sea, still the concentration of oxygen is exactly the same, but you're in a higher pressure, which means that your body's going to deliver a higher amount of that oxygen and circulate it throughout your body, versus when you go to the higher altitudes into the mountain ranges, it's sometimes harder to catch a breath because the delivery of oxygen follows, I think it's Boyle's law, where oxygen will diffuse from high pressure to low pressure. And so when you're in a high pressure situation, you're going to push more of that oxygen into your blood. When you're low pressure, like the top of a mountain, it might go the opposite direction, but you're not going to get this increased perfusion into your tissues at that low pressure. Is that like a decent?
No, that's perfect for the pressure bit. And what I want our listeners to understand is when you breathe, every bit of oxygen is being uptaken into your body in real time. There is no extra oxygen. So whatever concentration, like Nick's saying, whether you're getting it under high pressure, or you're getting less under low pressure, it's gone. Like there isn't extra. So when we talk about things like hypoxic tissue and we talk about oxygen as a nutrient, realize that your cells need oxygen. That's one of the main things that we feed our cells every day, oxygen and nutrients. And so whatever you're getting. And if there is healing needed in the body anywhere and you can't carry enough oxygen to that tissue or those cells don't heal and the tissue doesn't heal. So we're going to now kind of jump in. I'll let Nick talk about this.
Perry Nicholson did a brilliant job of also explaining this from a congestion point of view. Mm-hmm. And that was definitely missing in the conversation we had with Dr. Saunders. But I think this is a great way to sort of bring it full circle.
So you want to talk about everything that's affecting it?
Yeah, we talked about Tom Levy and chronic inflammation is also places devoid of vitamin C. We talked about the way that altitude affects things, but let's talk about from a lymphatic point of view, how tissues also become toxic or hypoxic.
No, that's a great idea. So Nick's talking inflammation, and what is one of the big bringers of inflammation in our body? Well, a lot of times if our lymphatic system, which is our sewage system, if this system is not flushing out regularly and renewing and replenishing and basically getting that interstitial fluid clean and clear, basically it backs up, and what happens is we become toxic. So think of little pools that start gathering in different pockets of the body. And this happens primarily, I tell my patients, we get speed bumps in our tissue because we all kind of move in very similar movement patterns all the time based off our ergonomics. So whatever we're not moving that's addressing different parts of our tissue, think of these little pool areas that basically lymph is getting stuck in and it's not able to move. Now, when lymph can't fly and glide through the lymph system the way it's designed to, it backs up, and then we start to get that interstitial fluid toxicity, which is a breeding ground that starts to change our terrain. It's a breeding ground for bacteria, viruses, parasites, all kinds of nasty stuff. So then our terrain starts to change in those areas of the body, and then that brings inflammation. So then inflammation is going to start to upregulate around our cells in that area. And the moment inflammation starts to hit, you got two things that are going to go wrong. One, when there's inflammation, tissue doesn't move very well. So there's already something that's going to affect the integrity of your lymphatic system, because your fascia, when you move, all the movement you do all day through your fascia is actually what opens these little channels in your lymphatics to help your lymphatics start to flush out. But the moment that inflammation sets in because the sewage system is backed up, that tissue does not move or glide, and it gets really resistant on any kind of movement or stimulation. So then the lymph capillaries don't basically open and close. So this is going to start this cascade of inflammation in the cell, like we talked, and then you can't get oxygen and nutrients into your cells because the membranes of your cells basically inflame, and it's like doors that slam shut. So on top of not being able to get any permeability through that cell membrane of oxygen and nutrients into the cell to basically feed mitochondria and create cellular energy, you basically are going to have another issue where you get hormone resistance as well. So then your cells can't hear the broadcasting system from your master system, which is your brain spinal cord. And then now you have a communication issue, and you have literally a depletion of your body's ability to feed itself at a cellular level so that you can function.
Yeah.
And so this starts to create a really bad problem. So like Dr. Perry Nicholson talks about with the lymph system, if you have a lymphatic issue, you have an immune issue. If you have an immune issue, you have a lymphatic issue. But there are other layers like Dr. Nick's talking about that kind of cause these problems. And the beautiful thing about hyperbaric is we can go in and fight back on this using it with some other therapies, like doing lymphatic type work and fascial work and stuff like that. But then you can pump the body full of oxygen to get that oxygen where it needs to go, where it hasn't been getting where it needs to go for healing. Because at the end of the day, we want to heal. And the thing I love about HBOT, man, is it's really good at doing that. It's another life force energy because it's oxygen, and you're pumping more of it into the body, and you're giving the body something it needs to thrive and heal.
Yeah. Yeah, and you did such a brilliant job of describing the whole tissue change and the toxicity buildup, the inflammatory state. And if you can imagine, like, if oxygen is that vital, just you breathing in 21% oxygen at, say, sea level or whatever pressure you're at, if your mountain region's lower pressure, you're not getting enough oxygen to actually stimulate part of that healing mechanism, because oxygen is a signaling molecule, it's a nutrient, it's all these things, but it's necessary for tissues to actually start to regenerate and to stimulate stem cell production and bring in nutrients in the lymphatic system, all the things that you spoke to. So we would technically need, for chronic tissue that's inflamed, that's hypoxic, you need a therapeutic dose. And that's essentially what hyperbaric is doing, is giving you a therapeutic dose of oxygen to be that messaging system for stimulating repair.
Well, let's break that down because I have some cool notes here. So we're talking about fighting inflammation, right?
Yeah.
So when Nick's talking about it's going to help remodel your capillary beds. The reason a lot of times you're hypoxic is because there's damage from the inflammation to your capillary beds. And so if those capillary beds are damaged, you can't actually feed and circulate that oxygen into those tissues. And then if we repair those capillary beds, we're going to have a decrease in that hypoxia and that damaged tissue, which enables us to carry nutrients to our cells and then waste products, which I didn't mention earlier, out of our cells. Yep. So guys, it's one thing, of course, we need to get things in our cells, but the other piece of that, like cellular permeability issue, if we're inflamed, is we can't get waste out. And so we need to be able to circulate to get waste out too. So one of the beautiful things that hyperbaric does is it repairs those capillary beds, which is it enables us to do that. And then as a byproduct, we get a lower inflammatory cycle.
Yeah, that's so important. And not all of us are necessarily thinking like capillaries, what are these things? But it's literally the distal termini, or the terminus, the end point for the vascular system, the blood system.
And these are so small, right? Like
tiny.
I want people to picture these in your head. Like it takes microscopes to see these, but these are so small that you can't see them with the eye. And these capillaries actually have vasomotion, so they contract. So depending on how healthy we are, we have good vasomotion, and that we talked about this with the beamer, right?
Yeah.
But when these guys are damaged, you can't push your blood where it needs to go. It's like a river that it's not moving. It's just stagnant.
And
so
these are
nothing's
like, just to
moving.
give like dimensional size, like, it's like one red blood cell thick, right?
Oh yeah,
Yeah, like they're tiny.
it's like it's as wide as, like Nick's saying, a red blood cell or a white blood cell. Like they're so small but there's damage here. So these are the guys that get broken down when we have chronic inflammation. And if you can't heal these things, there's no healing that takes place. I think even Jason, Dr. Saunders, his story is he had a low back injury where he had foot drop.
Yeah.
And he got in a hyperbaric at a conference and got out, and he had foot drop for like a year after he'd fixed his back, and it just wasn't getting better. And he started to feel his foot, and his feeling started to come back in his foot. Yeah. And that's when he discovered, oh my God, oxygen, I just got more oxygen into that tissue. So it's amazing, right? I mean, you push a little more oxygen in there, it helps the body do what it's designed to do, which is heal. And then we start to get like the nutrients in, the waste out, we get repair, and then the inflammation starts to drop. And then because we can get that transition in the cell, you're going to be able to feed those mitochondria that oxygens, which is going to help us increase cellular energy, right? And then they've even shown research with these things that it helps with the size of your mitochondria, efficiency, and density when you do hyperbaric regularly over time. So then the powerhouses on our cells are getting fed and they're repairing, which helps you have more energy. And we need energy to heal. So everybody, again, more oxygen equals more energy. And energy is necessary to heal.
It's really, I mean, this is a beautiful thing about this therapy, is that you're hitting it at such a core level that's necessary. It's literally a catalyst that tells your body, okay, it's time to heal. So, this is why we said near the beginning, why it's just the utility of this is just so universal for any illness. And if you talk about mitochondria, like, I mean, literally, that is the organelle within our cells that make energy. That like the only reason that they can produce energy is because oxygen is present. So to really hammer home the point of this chronic inflammatory state, that just the sheer tininess of these capillary beds and how easy it is for inflammation to develop as a result of this toxic buildup, the lymphatics, the vasomotion in the microcirculation. I was hoping you could even just highlight, not that we have to go into big detail, but just about the sheer proportional difference of large vascular channels versus the microvascular system. And I think that's important to put in perspective.
So when you open a book and we look at like the circulatory system of the body, primarily what you're seeing drawn in that anatomy book is our large vessels. This is the arterial supply, or you'll see the venous supply, right? And these are, I think it's like what, 23%? This is only 23% of our circulatory system, those large vessels that we see in books when you read books and stuff. So the
ones you can see in your arms, right? Like,
I mean, that's 23%. Those are the big guys. But the rest, the other 70, whatever the math is, the rest of that is microcirculation. So I think they say when you spread these guys out on a line, it can go for like, I forget how many miles. Like it's something.
Well, it's like right? Circles the globe.
It circles the earth. Your circulatory system for your entire length, if you were to line it up, will go once around the globe. They say that's how much of this stuff. So imagine how small these are. But again, they have to feed 70 trillion cells. 70 trillion cells are being fed by this microcirculation. So now, if you haven't figured it out, I'm going to say it. How important do you think circulation is? It's huge. A lot of people can't heal because they don't circulate well.
Yeah.
I've seen this with patients. I've seen this with my own mom when she had back surgery. 3 months after her back surgery, she ended up in a car accident, broke her back, had horrible trauma to her leg. She sat pretty much at home for about 6 to 8 months and just could not heal. Like literally her body would not shift. And it took me putting her on a beamer mat pretty much every day for about a 6-month period. And then she started healing. And it's because she didn't circulate well. She had poor vasomotion. Yeah. So like we're talking, I mean, that's just a quick story. And I'm saying that because a lot of people, you may be doing everything right, but because you're not circulating, well enough to carry what you need to the cells and to carry waste out, that's why you can't get healing done.
Yeah.
So I hope people understand that, because it's huge, and I think it's overlooked a lot of times on people when they're trying to heal, and they don't take that into account. But it's huge for healing, and like we're talking, man, like oxygen needs circulation, and so does your immune system, right? Like we have three main things that we're carrying. We have oxygen, nutrients running through our blood all day, right? And then our immune system, a response from our immune system runs through our circulatory system. So you have all these things that need to go on this highway all day long. And if you can't carry them, everything from like our cholesterol to our hormones, I mean, the list is endless.
Yeah.
But if we can't carry it, forget it. There's just the stagnation in healing.
Mm-hmm. And hopefully it's painting a picture for people, because I think, we all get stuck. Oh, it's the hormone problem. It's the, you mentioned the cholesterol levels. It's, the medication that I got prescribed for this particular condition. And what we're really asking people to do is take a step back. How does the body operate? How do nutrients come in? How do toxins get out? And if we're not addressing things from just that most basic fundamental level of physiology of how we deliver nutrients, we're missing a huge part of the process, right? And this goes beyond nutrition even, like obviously all those things are a part of the entire process, but I think we lose sight of our physiology. And I love that these biohacking tools, or I would call them life essential tools now, because like it's beyond just being a cool gadget that hacks your biology. It's like essential to life. So if you're not working on your vasomotion and increasing blood supply, if you're not giving the right stimulus for your mitochondria to heal, if you're not getting enough oxygen into your body, if you're not moving your lymph, those are basic foundational tools that everybody, who's in a healing crisis or needs to overcome a chronic inflammatory state, you got to address all those factors.
And they're essentials, brother. And they're so overlooked. They're so overlooked.
Yeah.
When people have a stagnation of healing, I feel like, some doctors don't even look for these foundational things to see, like, well, should I just check to see if they're even circulating well?
Yeah.
Or if they're getting oxygen where it needs to go, or if their immune system can even have the response. They don't look for this stuff.
Yeah.
And I feel like this is the first place you need to look. And then everything has to come after that. Just from an immune place, right? Like our immune system helps us heal. And we're talking circulation right now, we're talking oxygen. But if you can't just do these basic things like circulate and carry that oxygen, your immune system can't have that response. So then how can you fight infection? How can you clean up inflammation in the body?
Yeah.
Right? How can you change your terrain? You can't.
Yeah.
There's just no response. So like Nick's saying, it's a definitely a multi-therapeutic approach, but understanding that these aren't extras. These are, like I said, they're both life force energies. It's light and oxygen. Like I wanted to keep it that way, because that's one of my slogans for the Vitality Lab is like increase your life force energy. And our biggest two therapies that we do here are just oxygen and light. That's it.
Yeah.
And they're very powerful.
So let's talk about the patient experience. So you're what you're doing is you're going from normal atmospheric pressure. Again, your geography will dictate what pressure level you're at. You get into a chamber. What do people notice? What are some side effects? What are some problems with getting into the chamber, the challenges, and what would you notice when you're in there?
So the biggest challenge I think people have with is just getting to pressure. They're just the equalizing of the ears. So one of the ways like Dr. Saunders explains this is he says, look, it's kind of like going up in a plane and coming down. You have to equalize when you go up in a plane. Your ears are going to pop a little bit, and you swallow, you sigh, you pinch and blow the ears. And you're trying to equalize. Same thing for people that go scuba diving, like you were talking, when they go deeper, and then as they come up, they have to come up slow, right? So that's basically what's happening in a hyperbaric chamber. For the first like 4 to 5 minutes when the chamber is filling up, it's like basically going up in a plane or going down when you're scuba diving. So you have to sit there and pretty much equalize and get ahead of the pressure. But if you don't do this, you're going to start to get pressure build up in your ears, and your head may start to hurt and have a lot of pain behind the ears. And I would say that's probably the biggest thing that people struggle with. Yeah. Because outside of that, I mean, if you can equalize, then you can get in there no problem. There's plenty of space in there. And in the chamber, I know you have a good sized chamber, so there's plenty of room in there to just lay in there. I even stretch in mine.
Yeah.
I have people that fall asleep, but it's really just equalizing, man. I mean, and then we'll talk about contraindications. There's not many. There's very few, if any. But the biggest thing is just getting the pressure. And then outside of that, the only thing I would say on top of that is claustrophobia.
Oh, for sure.
If you're claustrophobic,
yeah,
don't even bother trying. Not going to be able to do it, because unless somebody has one of those big room sized chambers where you can just walk into a room and you don't feel claustrophobic, then hyperbaric chamber is not going to be ideal for you.
Yeah. I've some patients who are mildly claustrophobic, and there's it's a bit of exposure therapy. We put them in, hold up the material, just give them a sense of like how spacious it is. But we don't actually close it up and turn it on. Like, hey, that was step one. If you feel comfortable enough, do you want to try a little further? We can zip you up, turn the air on, but we won't increase the pressure. We'll just sort of leave you at the bare minimum. And then we move through that. So, it's not a hard no, but yeah, some people look at the thing like there's not a chance. And some people are interested enough that they'll, okay, let me have a little bit of exposure to it.
Yeah. We've the people we've put in there, they're claustrophobic. I've had some that are like on the fence. They're like, oh, I'm kind of claustrophobic. And then they get it like, nope, no. And I'm like, well, could have, yeah. So yeah, I mean, honestly, man, those are the only two things I see that would affect somebody's ability to get in there. Yeah. I mean, if you can equalize, you're fine. And then if you're not claustrophobic, you're good. Because once you get to pressure, it's just, you feel normal in there. You're just laying on a nice mattress. I put a nice memory foam pillow in ours.
Yeah.
And you're just chilling. Yeah. And just relax.
Yeah. So contraindications, I mean, there would be a list, you can definitely look online too, but some of the basic ones would be pneumothorax, which would be punctured lung, COPD, someone who's already got really inflated lungs, and so changing pressure for them would be difficult. And obviously any like open wounds and things like that aren't addressed properly. I mean, some of it's just sort of very common sense, but also I would say someone with a sinus infection, it's not a good idea to jump in there.
Yeah, anything that's going to affect your ability to equalize, like we've had some patients that are congested, their allergies are bothering them or something. I say, oh, we can't do this today. You have to wait till your sinuses clear up. But yeah, like outside of that, man, there's really not much. The only thing I would add to that list is if you're kind of like post chemotherapy, you might have to go slow and low with HBOT, because it actually will cause a lot of detox. When you start pumping oxygen through the system, so you might just want to go a little slower. But yeah, the biggest one would be the pneumothorax, right? And some big lung issues. But for the most part, most individuals can get in it just fine. That's not an issue.
Yeah, I've had patients with even post-transplant surgery, and it's really expedited their healing. So, and that one in particular was actually a lung transplant. So,
oh wow,
yeah,
I can believe it.
So, I mean, even for us, like as physicians, I reached out to Dr. Saunders, and, so we're always checking too. And a good, place that's delivering this therapy is going to be more thorough, because obviously, minimizing harm is the most important thing when you're using any therapeutic. But I mean, these mild pressurized chambers, I mean, you can bring your phone in there. It's very, very comfortable. It's not like the hard shell chambers where no technology, nothing. It's just you in the chamber. It's a different pressure, right? And it's different saturation of oxygen. So that's the other thing I think we should talk about, is that, in these chambers, you can add an oxygen concentrator. So that as you pressurize the air inside these chambers, they're still pressurizing normal atmospheric pressure. So still 21% oxygen in a pressurized environment, up to 1.3 to 1.5 atmospheres of pressure. But then when you add an oxygen concentrator, you're taking up to about 93% oxygen that you're breathing in. If you've got the right mask, you can get up to about that amount. So you're drastically increasing the concentration that you're breathing in under a pressurized environment, which means you're going to saturate your hemoglobin, which are the parts of the cell that carry oxygen, but now you're also diffusing oxygen passively across this high concentration in the environment into the lower concentration in your tissues. So you're getting more delivery of oxygen into tissues that are, again, stuck in inflammatory states. You're not having to use just hemoglobin to carry that around, which is fascinating that we get this increased diffusion across into our serum, into our tissues, and beyond.
Well, I think one of the ways that Jason explained it that helped me visualize it better was when you're in the chamber It's like seltzer water opening up in your bloodstream. So
Love
like Nick was saying, like you're not left with the oxygen carrying capacity of your hemoglobin. Once you're in the chamber and that oxygen's pressurized, the moment you breathe it in, whatever your cells can carry, they will load up, but then all that excess oxygen is going to carry through your blood and go where it needs to go. So like we talked about being out of the chamber where there is no excess, the moment you go in there, that 94%, if you have a concentrator like me and Nick do in our chambers, you're just getting fed this abundance of oxygen for the whole time that you're in there. And all that excess is just traveling to areas of the body that need healing. And then it's just loading that part of the body up so that it can heal.
Yeah. Yeah. Amazing.
So real quick.
Yeah. Anything? Go ahead.
I just want to, like, from the patient standpoint again, like it's chill in there, right? Like you have a mask on, you're just laying, you can take a magazine in there. We don't let people take electronics. I like them to either read or just chill and just tune out.
Yeah. That's not from a safety thing. That's more like turn it off.
Just turn it off. I don't, people need to get off their devices more.
Yeah.
So I don't let them take it in.
Yeah.
But just to kind of summarize a little bit, like what are all the benefits we're going to see from this? One, you're going to get more healing when you do oxygen therapy.
Yeah.
There's no ifs, ands, or buts. Two, recovery is amazing. That's one of the things I love about the chamber when I get in. Is my recovery is awesome. Like it's so much faster.
Yeah.
I mean, this isn't just if you go to the gym recovery, if you're an athlete, that's all always great. But I'm just talking about daily recovery. Like I just float through the day that I do it. The next day I'm still floating. I sleep. Sleep is awesome. That's one of the things a lot of our practice members tell us after they do the hyperbaric, because they say they sleep like $1,000,000. Inflammation's coming down. We talked about that. It helps kill infections because of the immune response, and it helps kill off bacteria. Okay. Fuel cells. We talked about that. Upregulates ATP because we're able to feed more oxygen in there. And it actually helps heal the nervous system. So they've had research show that it helps actually heal the brain, and it heals nerves and so on and so forth. So, I mean, who wouldn't want to do more oxygen, man?
Yeah.
Like it's
there's also
accessible now.
There's also that Israeli study that looked at hyperbaric at a specific pressure, specific time that was actually activating sirtuin genes and helping to stimulate this longevity response. So, I think it's exciting to think of, if we step back and look at all the mechanisms for why we deteriorate, why we propagate inflammation, like we discussed earlier, it's also very exciting to see that this is actually a regeneration tool from like a longevity or health span point of view as well. So I think like there's so much we don't yet know, and there's so many different areas within medicine that these sort of we call them off-label uses for hyperbaric, because hyperbaric in the hospital, there's about 8 conditions that it's only used for. So again, access for the majority of people is so limited, which is also why, I think Jason's really incentivized, I think, to get this out there more, because more people could benefit from this. But when you have a therapeutic that's only listed for a certain amount of conditions, it limits its reach. And, within good reason. I mean, obviously hospitals are going to operate under a different set of criteria. They're not going to use a lot of things in an off-label setting because research drives therapeutic use. Whereas in, our type of medicine, we can go from a more clinical perspective and piggyback off research and sort of extend, the reasoning to use this type of therapy. And the results in the research is slowly but surely coming out for a much wider utility for these, even at these low pressures. So but it is important to differentiate, I think, just for people listening. This is not hard shell chamber 100% oxygen saturation in a hospital environment. It's a different animal, and there's a time and a place for both. And I think that's what's really important here.
Well, I want people to understand, like, it's highly therapeutic. You don't have to be in the hospital style chambers to be getting the benefit. And again, to talk about what Jason's doing, like he's going to school to become a PhD to prove this, to like let the masses know, like, look at all the stuff you can do with this.
Yeah. Because
nobody's done it. And that's and hats off to Jason, man, for taking on that responsibility, because that's huge.
Yeah. Yeah. Massive. Yeah. So, I mean, obviously there's a lot more to talk about with regards to HBOT, but I think that, we laid out a good, reason for using it, the physiology, the mechanisms of use. And I just look forward to hearing more stories about how it's going for you in practice, buddy. And and to hear more about where Jason takes his research too, because it's exciting.
It's been fun, man. The circuit we built with the light bed right before you get in the chamber has been amazing. I mean, you go in, you jump on the red light bed, you increase that nitric oxide in the body, you start to circulate like a champ. You're already starting to reduce inflammation. You're calming the nervous system down. You're basically priming the body to uptake more oxygen.
Yeah.
So then I put them in the chamber like right after, and they're already opened up, man. So they're already circulating like way, way better than they would be. And then we put them in there, and we start feeding oxygen through their system. And so the absorption and the transport of that's probably tenfold after the light. And they work synergistically with each other. There's some coherence there. And like I said, if you ask me, between those two therapies, that's like the fountain of youth, man. Like, I wish I could do a light bed session in a hyperbaric chamber every single day.
Yeah. I love that we're sort of closing off on this. Like, there's the synergy in you using these tools in a very cohesive way. I think that's part of I think what gets lost in even research is that and fair enough, they're looking at single-use therapeutic in a very particular narrow window, and so not always looking at things from multiple platforms, which is not necessarily the scope of research anyways. But to actually see a clinical application of using these synergistic tools together in a treatment plan, I mean, that's where the results just improve in an extremely considerable way. So I love that you left it there. That's really good.
Yeah, it's fun, man. It's just neat to see how the body responds. That's the part I probably enjoy the most.
Yeah.
But yeah, try it out. Go find some place that does it and give it a shot. I would probably do more than one. I would do probably a series of them.
Yeah.
And even combo them with some other therapies if you find a Vitality Lab or a longevity center like we have, and give it a go round. Because I promise you'll thank yourself that you did.
Definitely. All right, brother. Until next time.
Love you, man.
Love you too. Bye.
Thanks for listening. If you enjoyed today's podcast, please be sure to subscribe to the Dr. Dads and share with your family and friends. You can also follow and interact with Dr. Nick and Dr. David on Facebook and Instagram for a daily dose of inspiration and the latest in health and wellness. Be well.